So it's my great pleasure to be talking to my friend and colleague, Simon Mills. We've known each other for many, many years, but watching Simon really build herbal knowledge, experience into this amazing movement for change that we're all part of, broadening medicine, has been really exciting. So I'm going to start with my question, Simon. Why does integrative medicine matter to you?
Well, thank you, Elizabeth, and thank you for inviting me on this program. I'm very, very honored to be here. Well, the quick answer to that question is it never wasn't a part of me. I'm, as you can tell, of a vintage, and I actually did medical sciences at Cambridge, and so my first mates were all would-be doctors. And although I chose to go a different path, which I might come back to later, I've always maintained that connection and indeed kept up to date with, I see myself primarily as a physiologist. That was my big enthusiasm at Cambridge. It was a good place to be for that. So I've kept up to date with the whole story developing and evidence around medical sciences generally. And then when looking for something exciting to fill my life, I found that I could combine my interest and background in plants with medicine, and then started practicing as a herbal practitioner in the late 70s. I immediately started connecting with other people in other parts of the health spectrum. And, well, one critical time in my life, which I'm always proud of, is that I was in a room with 4 other people. One was Richard Tomkin, a consultant, London. One was Harold Wicks. Then there was Robin Munro, and finally Stephen Fulder. And Stephen and Robin had just completed a report on quote unquote alternative medicine. And in this conversation, I remember very clearly Stephen saying, we need a new name for this so that it fits in with the wider spectrum more responsibly. Why don't we use the word complementary? And out of that meeting, the Research Council for Complementary Medicine emerged, and I was obviously part of that. And immediately that reinforced this conviction that I had that that we could only do this together. And ever since then, I have had more friends who are GPs and other docs than I have had anyone else. So I've breathed and lived integrated, as we used to call it, from the get-go.
Yeah, and you describe this kind of evolution. I'm aware that when our marketing team look at how people might find the National Centre for Integrative Medicine, people will still put in alternative. But we've lived through complementary and alternative, which was CAM. And, we were building research capacity in the early 2000s within Bristol University. And then skeptics came in pretty hard and push back on universities training people in what we would call CAM. And then integrative medicine, coined by Dr. Andrew Weil, very much reinforced what you're saying, is about putting it all together, conventional, complementary lifestyle. And now there's the big player on the block is functional medicine, and many doctors are training in functional medicine. But if we look globally, then we look at traditional complementary integrative medicine, or TSIM. So I don't know whether we've landed on a name that's going to stick, but it's amazing that you've been in this movement for change all that time. You and I love herbs. We love plants. We love connecting. I just wonder, it's still tough, isn't it, in the UK, in the NHS, to include herbal advice, even for some of the players that we've got good evidence for, like Echinacea to shorten the days of cold or flu-like illnesses. Ginkgo, I'd love you to talk about, but tell me why do you think there might still be barriers to doctors learning and being able to recommend or even prescribe herbal medications?
Well, the first answer is I'll turn to my granddaughter, who has just become a doctor, which gives you some idea of my vintage. And that her experience coming through reinforced an obvious point, which is that medical student now has a life jammed with material that they have to absorb. And it is all, of course, led by medical developments and has increasingly become, as you and I would agree, more segmented and even fragmented in terms of the holes and paths down which you go. And it's just bewildering, the amount of information that the young medical student now has to absorb. And you and I know, because we probably both shared the same platform at times, talking to medical students. They're up to here with with stuff. So, and as you know, they don't even have much time for food, let alone anything else. Unless you fit into those fairly tough, predetermined places, you don't get much of a look in. Herbs and plants in general have another problem, which is that they are not easily pinned downable. And so, the general view has been that you can't quantify them sufficiently to make them a pharmacological entity. We know that is incorrect, that there are many medical practitioners in Europe who prescribe things like ginkgo and hawthorn and echinacea and valerian and so on in very tightly produced forms, so that you do get standards, you do get reproducibility in the herbs. But for some cultural reasons, this pattern has never come across to the English-speaking world. I think I would just say the English-speaking world rather than just UK. So if you look at, I often say there are 5 countries in the world where herbal medicine is not in the majority mainstream. We are one of them. Canada, USA, Australia, New Zealand are 4 others, and I'll leave Ireland as a bit on the edge there. But you can tell they all have in common cultural distinction. So I think there's something about the Industrial Revolution and its effect on old traditions, which has hit us harder than some other countries in the world. And so we have this cultural pushback against using crude drugs as they can be defined, so that there's another hill and a hurdle for the average doctor to cross. And you and I both have spent a lot of time talking with doctors about why don't they use some of these things, and almost always they're very excited by it. I've done lectures with doctors for 30, 40 years, all of whom are very excited by the thoughts that I sow into their heads, especially about things like ginkgo and so on. But when it comes to fishing out your prescription pad or going on screen, as that we now do these days, doctors do, there is certainly not there.
And some of them were there, when there was a ban of herbal and homeopathic products in 2019 that took away the ability to prescribe. But my feeling is that, and I'm going to talk about some of the science that's emerging, that we really need to get that back. I know how much the medical students, we have student choice placements, they absolutely love the botanic gardens. I love the compassion that you have to your granddaughter and to doctors in training. They're learning to be experts. They're absolutely packed with a curriculum that doesn't give them much leeway. So trying to keep messaging, clear and available can be really useful. So can you talk to our listeners about ginkgo? Because it feels to me in this arena of later life and how to optimize health, this could be important.
Yes, although it also has another very interesting story about the role of plants in medicine, because the ginkgo you and I are talking about is not actually the plant. The plant, the leaf of ginkgo, which has been standing for humans to use for millions of years, was not used by the cultures in Asia where it started its life. So when it was German researchers came to China and saw the ginkgo leaf, and because they were German and they were very imbued by German traditions of what we might call doctrine of signatures, they saw the heart-shaped leaf and immediately said, hurts, that must be a heart remedy. And the locals said, oh, no, we never use that. We use the fruit. However, true to their hunch, they took the ginkgo leaf back and extracted it, so that the ginkgo that we use in medicine is a 50-to-1 extraction. And it is very high in its active principles, much higher than the original leaf. So, first of all, when someone says they're providing ginkgo, the next question is, what are they providing? Because the only ginkgo with any evidence at all is DGP 761, which is the Schwabe extract that is the basis of all the clinical trials that we've had. And it is quite distinct from the original leaf. The first thing, we have to get something like or that or something like it if we're going to be seeing any effects at all. So this ginkgo medicine, of course, was largely confined to Germany for many years. The French then took it on. And in both countries, for many years, ginkgo was one of the most widely prescribed drug in Germany of all, beyond aspirin or antibiotics or anything else. It was hugely prescribed, not least because anyone over 50 who went to see their family doctor would almost automatically be given ginkgo to help them through their old age, because there was a strong conviction that it would help them to stop getting dodgy as they get older, and cognitive functions and all the rest of it would be seen to stay improved. Then in the mid-90s, when there was a bit of a financial cutback, that was de-reimbursed, so that the usual practice of getting your prescriptions covered by the state didn't apply to ginkgo, and for a year or so the prescription rate dropped like a stone. But interestingly, over the 2 or 3 years after that, it climbed back up, led not by the reimbursement, but by patient demand. So ginkgo remains still very widely prescribed in Germany. It is widely prescribed in France and in other European countries as well, particularly for those of senior ages. Now, what is the evidence? There is quite a lot. It's mixed, but it's becoming more consistent that it does help in aging in the brain, aging functions, whether it's just senescence in general or even in various types of dementia. And some of us are very interested in its potential and actual effects on circulatory as a whole, so that we see it in a much wider sense and helping to improve microcirculation in many other functions around the body, in the kidneys, in immunological disease and so on. We can often see when we use a strong ginkgo a difference in the body's response. And it comes to the original idea, the Hertz linking the heart to the remedy, reflects a very, very old traditional view, which is, I would say, fundamental in medicine, back to before history, that circulation, or as they would often describe it, heat, was fundamental to the principle of therapy. And heat was easily understood by everybody, because anyone who's ever felt a dead body will know the difference between a living being and a dead one, and that is the heat. The dead body is, as we distressingly discover, stone cold. So life became equated with heat. And in various parts of the world, heat became, as it should be, equated with circulation. So what the Germans were doing was basically touching on a very old story, that if you can improve the quality of the circulation in various parts of the body, the chances are you will be improving restorative functions, healing, vitality in a range of ways. And I think ginkgo just happens to be the most widely prescribed of remedies of that principle. The one that is most widely prescribed of all, or most widely used, of course, is ginger, which has a different effect, but is certainly heating. And in the North America, particularly, and Central and South America too, cayenne or chili was their primary remedy because of its effect in improving heat, vitality, restorative functions.
And we kind of are understanding as well that, and I wanted to come on to ginger, it's also reducing inflammation. So you've kind of got double advantages. You're increasing blood flow, but you're also decreasing a block to flow that might be building up in small vessels as we age. And you taught me about gingerol. I got very excited. Would you say a little bit more about ginger and its properties?
Very much so, because it's one thing I can't get bored of. Yes, you're quite right. The word anti-inflammatory is a word that I resist using, because we all know that inflammation is in fact a defense measure by the body to bring in the big guns, shall we say, when there's a issue, where there's debris, where there's infection, or where there's stuff to be cleared out. So it brings in a lot more blood. It opens up the blood vessels with painful agents, like histamine and so on, for the purpose to bring in the reinforcements. What we see, the heating spices, and ginger, there's cayenne, but topically, for example, it was mustard and horseradish, so you talked about the role in inflammation. Well, the obvious traditional example of that is if you've got an arthritic joint, you slap a mustard plaster on it, or a horseradish plaster, and what you are applying is external heat to the joint, which is very easily demonstrable, by the way. You definitely get more blood supply. If you've got the pale skin, you'll see the pinkness showing through. And what you get is immediate relief of pain, and that's why people use it. It's not for for romantic notions. It's because it allows them to get back to work. What's happening is that those heating agents are bringing in the blood without the painful reagents. So you don't need as much histamine, you don't need as much of the inflammatory agents. So you can do the inflammation's clearing work without all the pain. And that is the principle that we see applied over and over again. And if you take ginger internally, and when we were young and had our first students in the herbal course, we built a couple of thermos regulate sensors, which you could put on your skin and swallow a capsule with ginger or cayenne and watch the temperature rise on the surface of the skin within minutes, because a lot of this is reflex from irritation of the gut lining. And so what you're seeing is a direct increase in circulation, which in a way does what I've just been saying about the topical one. And I once remember, this is one of the turning points in my life. I remember when I was a medical student at Cambridge reading an old pathology book in which in the foreword the author said that most pathology is a failure of oxygen and blood supply to the tissue, but as you were saying earlier. What if we could find a medicine that gently increased the blood supply to the tissues? We wouldn't need pathology. It wasn't quite those words, but it was a similar sentiment, and that stuck in my head. And I thought, yeah,
it's a different way to look at the body as this kind of incredible self-healing, self-balancing organism, because inducing fever, which we would do with mistletoe in the cancer patient, we now understand that fever mobilizes the immune system. And there was a very interesting piece of research from Bristol Uni showing that if you reduced fever in children with a combination of anti-inflammatory and paracetamol, you actually lengthened the course of the illness. And that was mainstream publication, and they kind of avoided the findings, which were very significant, which is actually we need heat, we need fever, maybe in the extreme when we're properly ill, to bring us back to balance. But I guess what you're describing is when we're well, then there are ways to feed the body literally with things that can help it self-regulate. And I know that ginger, and maybe you'll talk to me about turmeric, but also their effects with the gut health, with the microbiome. So again, you're getting multiple benefits, aren't you, from these incredible spices, plants, food.
yes. Yeah, definitely. And in fact, I'm very quick to come on to the effect on the gut, because as we know, but just to come back to your fever story, my first brush with notoriety was when I was just starting out and I had 2 young children, and I gave an interview to a local journalist here in Exeter saying that I hadn't given my children a particular vaccination because I felt that, I was taking responsibility for that, and that a fever was something that could be managed. It was part of the body's defenses. I'm not an anti-vaxxer, by the way. It was just happened to be one particular conversation. And I got 2-page spread in the local paper on that one with the headline, "Father is happy for his children to have fevers." And I thought that would be the death of me. In fact, I got more patients from that article than I got from anything else. But I've stuck my neck out on fevers right from the very beginning. And a good fever, and you just can reinforce that point, a good fever is often the only one you need to have. It needs to be well managed, and you do need care with some of the complications of fever. And of course, there can be infections that need separately dealing with, and we don't want, another measles epidemic or anything like that. But there is a place for a well-managed fever. I sometimes described it as the old Maasai thing of killing your first lion, that what you do in a fever is to prime your immune defenses so that they are much more alert, and the innate immune system that we want to keep at the front rather than the acquired one that everyone gets trouble with. The innate immune system of neutrophils and various phagocytes of one sort or another are the good guys in this story, and fever gives them a really good outing. So the idea that we fear fever, we need to give it all respect, but it can make all the difference. And for one reason or another, my two children are now parents of their own, and they've never had any other problem since they've had their initial childhood fever, well managed, I hope. So just on that one, but coming back to your point about ginger and indeed turmeric and the effect on the gut, because we now very briefly know that both of those are prebiotics in different ways than the usual vegetable materials and grains and so on, and fiber. Turmeric particularly has had a lot of work done on it. And as you know, people who sell turmeric in supplement form pride themselves on having higher levels of curcumin or bioavailable curcumin, because everyone knows that curcumin is not well absorbed from the gut into the body. 1 or 2%, in fact, is very low levels of absorption. So you add a bit of black pepper, like the Indians used to do in Ayurvedic medicine, and you get it up to 3 to 4% maybe, but it's still very low levels of absorption. And people think that's a problem that needs to be overcome with nanopharmacology, with nanoparticles and various other modern techie things to get more curcumin into the system. To which one would point out that curcumin in any level is toxic in the tissues. There's a good reason why it remains in the gut. So that's one issue. There is evidence that a curcumin that does reach the bloodstream is beneficial. But there's another very quick follow-through, which is that curcumin belongs in the gut and seems to have most of its benefits in the gut, and most of its effects in reducing inflammation are likely to be because they change the gut flora away from inflammatory producing organism, the ones that produce lipopolysaccharides, the main inflammatory agent that we absorb from the gut. LPS absorption is reduced with turmeric curcumin in the gut, and there's a lot of smart money that says actually that's the benefit of turmeric. It's in the diet at dietary levels is sufficient to reduce inflammatory things in the joints and other parts of the body, simply because it dampens down the provocation that obviously does come from the gut.
And do you have particular preparations that you recommend? My 89-year-old mum that I'm with at the moment's got some arthritis, and I use turmeric when I get postmenopausal joint pain, and I find it settles quite quickly. But I do use a supplement, with ginger, turmeric, and black pepper.
Yes.
Do you always feel it should be food, or are you okay sometimes with supplements?
Oh, no, I do. I would just look for a good supplier, and whenever I do recommend a supplement, I always say go for someone with a reputation to protect, rather than go onto the internet and find things that are cheap and easy and with loud claims. As we know, we should be making claims for these things. It's a dangerous territory. But if I felt that there was a need for turmeric in some quantity, and heavens, we don't have curries 3 meals a day like many people do in Asia. Turmeric is bound to be less than the average Asian. So what can we do? The answer is to take a supplement. And while I was at it, I would go for a supplement that was a good, strong extraction, so that you get the equivalent of, you can buy ones that, are the equivalent of eating 12 grams of turmeric root or something in the capsule. And there are reliable suppliers out there. I'm not going to name names here. But yes, in your mother's case, I would suggest a good strong turmeric extract as in a capsule form, so she doesn't have to taste the stuff. And of course, it is fiendishly yellow. So I don't use turmeric as a tincture because the whole dispensary would be turning yellow before long. So it's
And
almost
when
always.
you grate it, you can end up looking like a smoker, can't you?
And turmeric manufacturers have to have a special annex where they prepare their turmeric from other parts of the factory and their workers have to go in with spacesuits on because everything is yellow in there.
Well, you're sorting my family out, and I wondered if you might sort my sister out as well, because it's like many people at the moment, they're getting recurrent viruses. And I just wondered, what you would have in your toolbox to recommend to people who want to improve their immunity, maybe reduce the number of viruses they're getting.
Well, that is one of the big issues we have, isn't it, these days? And let's start with the positive, as we did at the beginning, Elizabeth. And I often say that every time we walk into a public room, particularly where there's carpets and curtains and soft furnishings, we're inhaling rhinoviruses and ectoviruses because they're in the air. And my mother, who propelled me into medicine, and the idea that I might get a Nobel Prize or something, said, and you may find the cure for the common cold. Well, I was able, before she left us, to actually say, well, I had found the cure for the common cold. It is the average person who doesn't get a cold when they enter a public space. The cure is within us. So that we then put the question back, why do we get a cold if we go into a space where there's viruses? And the answer is because we let them in, isn't it? So the answer to your question is, what can we do to improve innate defenses and the acquired ones as well, as I guess, but mostly the innate ones, the barrier defenses and the other defenses that we constantly use to stop ourselves getting infections. And that, as you know, is very much a case-by-case basis, because you look back in someone's history and you maybe find there's a pattern of these things, as you were hinting there, constantly getting winter colds or whatever. So why is it winter colds? Well, obviously the primary defenses in the airways are hanging around the throat. Are they still got their tonsils? Are there any other issues that we could work on there? And often, to cut a long and tedious story short, we're often focusing on the throat if we're talking respiratory. And in the herbal world, we have a lot of remedies that work extremely well in arming up those innate defenses in the throat. And everyone knows about Echinacea. I would argue here for a Echinacea that makes your mouth tingle. Because it's the tingling factor that we're increasingly pointing to for the benefits here. I use Echinacea angustifolia, which I get from my colleague Kerry in Australia. And anyone who ever wants to realize what Echinacea can feel like, all we have to do is take a drop of this, and it feels as though there's fireworks going off in your mouth. It's very striking. And that is what I use as part of a frequent mouth-throat approach if I suspect that there are failures in those defenses. But the other one that, again, most people don't know about because we've lost it are the resins. So the one I use is Myrrh, but also there's a 90% calendula, 90% alcohol calendula extraction where you use 90% alcohol because you need a high level of alcohol to dissolve the resins. But when you add that, and you need something like licorice to hold it in solution in a combination, but that sort of mixture of resins, licorice, echinacea, you can feel it working instantly. What the resins are doing is coating the mucosa with the resin, and you can almost feel the innate neutrophils and so on being given a kick and beginning to get much more active. And the effect on throats and mouth and other issues is dramatic. Very good for gums as well, by the way. So that we why do we lose resins is because when we invented glassware, we discovered that resins coated these beautifully curated burettes and pipettes. And it's very difficult to clean those things, as you know, particularly if there's resin on them. So the first thing the natural scientists did when they discovered glassware was to get the resins out of their plant extraction so they wouldn't wreck their lovely glassware. And so we've lost resins as as a remedy ever since glassware was invented. But if you go back to the story of the Bible and baby Jesus and so on, 2 of the 3 gifts that the Magi gave to the baby were resins, frankincense and myrrh. We call frankincense boswellia.
Yeah. And these are all resins of trees, aren't they? Like
Sap,
the boswellia, the sap.
And as I said, calendula flowers. If you ever press a calendula flower, you'll feel the resin in the. But if you extract it in ordinary tincture form, the resin stays behind because it needs a very high level of alcohol to dissolve it in the first place. Yeah.
So resin, are you able to say exactly what a resin is then? Is it
it's a very complex range of alcohol soluble, in other words, insoluble in water substances move from the liquid. So you get the balsams, your balsam of Peru and various other things. And then you get through to the rocks like myrrh and indeed frankincense or boswellia. They're both, as you say, fractured, dried gum exudates, which are like rocks. You need a hammer to break them up. So there are a very complex range of chemical structures in these resins. They all have in common that they're insoluble in water.
And the tree uses them for its defense, don't they?
Yes.
Yeah. So we're kind of
taking
asking the
leaf
tree
out
to
of their
give
book.
us a bit.
Yes.
Yeah. Fascinating.
And the old story of Solomon marrying Sheba was sometimes seen as a cynical maneuver to get his hands on the resin market, because she, of course, lived in the part of the world where both frankincense and myrrh were naturally sourced.
And worth a lot of money.
And worth
like
a huge amount of
gold.
Yes, as indeed those 3 gifts were, yes. Yeah.
Yeah, amazing. So beautiful to hear the things that you might do. And I'm just thinking again, like I don't think I have Echinacea in my fridge. If I get ill, I just start it with a few other things like zinc and vitamin C. But I'm thinking of olive oil as well, and that catch in the throat, which can feel very strong sometimes when it's an extra virgin olive oil. And that, I think, is its anti-inflammatory prostaglandin releases. Do you know with olive oil?
Not particularly, but there are many. I mean, we use the olive leaf, so part of the olive is sometimes used in our medicine. And I would just add that there are most plants have constituents that are active topically in the mouth and the throat. So if you have an extra virgin oil, you'll likely be getting various polyphenolic and other elements in there, which we know, even in the context of a salad or a fruit bowl, will have positive effects on the mucosal defenses, which is another reason why we recommend people have more plants, is for all sorts of reasons. But one of them is because they actually are good for your innate defenses up here. So I think you're just observing an element of that.
And the other thing I always have at home is elderberry, sambucus.
Yes.
Which, my adult children now, when they're home, they'll kind of know that I'll have these things, and they kind of. I remember when my youngest was a little girl, like she must have been maybe 3. In the middle of the night, I was so tired, I approached her with Calpol, paracetamol, and she went, "No, only mummy's medicines," and she sent me away.
Good
so
honor.
I feel like that innate quality that we see in children, sometimes animals, to know what they might need. But it's about like providing those things, having those things, and as you say,
and rediscovering them, isn't it? Because so many of us don't know about these resources that are to hand, and we've become increasingly dependent on the prescription or the popping across to the pharmacy to pick up something that'll solve the problem and go back to work straight away. The old way, where you had a sickness or you had an infection, the infection you'd work through as quickly as you could, but then you would allow, a few days to recover, what we used to call convalescence. That pattern has been driven out by modern life. And one of the reasons why I tend to get to see people who are vulnerable to viruses or infections is because they never resolve the first one.
Exactly. It kind of has lingered.
Because if you're going to hit an infection with an anti-inflammatory or some other, or simple, one suppressant or one sort or another, it's going to come back.
Mm.
If you can
And
resolve it at the beginning, it won't.
yes. And it's about working again with the body, isn't it? To really throw that off. We have that phrase, oh, she was able to throw it off.
Excellent.
And I think it's about how to stimulate the body in various ways. And that knowledge, I think you and I are really trying to give it back to people. Like they all head to A&E and the A&E team say, go away, stop arriving.
Yeah.
But if we were able to give more information for self-care and also, slow medicine, just giving yourself time, giving the herbs time, to recover, whereas we want to fix it and move, don't we? And I think that can prevent the deeper healing.
Yes. Having said that, I do disabuse people of the notion that herbs are slow in terms of any effect you see. Yes, the recovery sometimes can take months if you've had I sometimes say you need a month of recovery for every year of your trouble. So if you've had a 10-year-old problem, we allow 10 months fully to recover from it. But I'm always looking for steps along the way in my work in one-on-one with my patients. And I will frequently say, call me tomorrow after they've left, because I want to see what effect they've noticed immediately, because herbs work instantly in one sense from the throat, as we said, but stomach and down the digestive system is almost straight away. Many of our remedies work on receptors on the gut surface, almost instant. So we can, and particularly given the strength of the remedies I use, when people taste them, I always ask them to taste them in front of me so I can watch their face. And they, the first thing, my heavens, I didn't expect hers to be like this. They feel as though they've been whacked in the nose. So the idea that we need to hang around forever before anything happens, I think is something we can disabuse. But yes, give respect amount of time for the tissues and the organs and the functions to reprogram themselves is not an overnight thing. We do need to work to allow the body to reprogram itself or reboot its functions.
And to kind of check in with it, to listen to it and
absolutely
see what its next step might be.
As it works through its reprocessing, yes.
We're moving towards the end of our conversation. I could listen to you forever. There's so many different areas I'd love to explore. We'll have to get you back on. But I just wondered if there was anything that was exciting you at the moment that you wanted to share with our listeners and viewers on YouTube.
Yes. Well, first of all, I pick up a bit on what you were saying earlier about the role as teachers in encouraging more self-care and more self-reliance. I think that is a key part of the original word physician, isn't it, which is to be a teacher. Now, probably the area that I'm most excited by, we've already mentioned the microbiome, which is stepped up. Everything we learned when we were a medical student is now being put in a tin box because it's all dependent on how the microbiome is feeling. And I would always go upstream from the microbiome and look at the liver because the bile is a major determinant of microbiome function. And that's a variable in itself. But the one thing that's really becoming, I think, excitement is the redescription of what used to be called the blood-brain barrier. The interface between the rest of our body and the brain, the central nervous system, that used to be seen as a barrier, which was most effective when it didn't let anything through. We now know that it isn't a barrier. It's actually a very dynamic interface, an interaction between the nervous tissue and the rest of the body. And the barrier, so-called, is actually an adapted capillary wall. As the blood vessels move into the brain, their wall gets adapted with the inclusion of glial cells from the central nervous system, particularly astrocytes, but there are other glial cells available, which form part of the wall of the capillary at that point and become a very active participant in a conversation between the blood and the brain. And all our worries about dementia and cognitive functions and brain health and neurological health and psychological health are all now being seen as variations on what we call neuroinflammation. And the main determinant of those inflammatory changes in the brain are disturbances in glial cells, particularly mediated by this interaction on the blood vessel wall. And the interesting thing is that so far, most of the positives that are being identified in improving the function of these, the blood-brain barrier is now called the Neurovascular unit, NVU.
Mm.
And most of the agents that are seen to be positive in this world are dietary, plant-based agents. Green tea, not as a supplement, but as a drink, keeps popping up. Rosemary. Almost all the vegetables and fruits have constituents that are now looking to be very exciting in relation to their effects on improving the conversation between the blood and the brain. And that really, I think, given our current health priorities, really is exciting.
And it is truly exciting. And also the glial wash, the idea that those glial cells will kind of purify or detox the whole brain sometimes overnight.
The lymphatic system.
Yeah,
As
so
it's called, yes.
it's like, again, these incredible parts of our body that are doing such beautiful work. And just with this neurovascular unit, did you say?
Yeah.
NVU, neurovascular unit. I'm thinking about, pondering and realizing I didn't quite understand that with the gut being responsible for producing so many neurotransmitters, how did they get to the brain? Is that through this kind of...
There's about 17 different ways.
Okay.
Not all of them are consistent. So many of the hormones and neurotransmitters released in the gut stay in the gut. I mean, we know that most serotonin in the body is actually produced in the gut, but little of that actually reaches the brain. So most of it's used for digestive performance, one sort or another. But there are many other ways, and side ways and indirect ways and reflex ways. So the vagal nerve, for example, is a two-way connection in which the gut lets its feelings be known. It does have its feelings. It's got its own nervous system, as we know. And there's this conversation. I keep talking about conversation. The word increasingly used in this is crosstalk. And the crosstalk between the gut, the microbiome, and the brain is multifaceted and involves all sorts of agents and connections. It's absolutely, who wants to go to sleep with this sort of work? It's so exciting.
It is, and we probably should end there. But just on that note, what I love about integrative medicine is I never get bored, and I'm always learning. And so, although retirement looks like it should be an option, I find that there's too much happening, too much of interest. And I want to thank you, Simon, for your incredible work over decades, and recreating and bringing new ways. You've got a wonderful website, Mills and Bone, which we'll put in our show notes. Anything else you'd like there to connect people?
My personal website, which has got more information than anything else, is called plantguides, one word, .net. Plant Guides.
Wonderful. We will put that on there, and anything else that you'd like, because it is incredible, the body of work that you've done. And also, as you say, staying excited with new information that helps us join up the dots. So thank you very, very much for your time.
Thank you for allowing me to chat away like this. I always enjoy talking with you, Elizabeth.
Take care.